Hi, I'm Corey Hughes with Ried Physical Therapy, and I've got some information about shin splints and what you can do to fix them. Shin splint can mean a couple different things. That pain in the anterior lower leg, kind of the front part of your lower leg, the shin, can come from a couple different sources. The muscle itself, so that little muscle that lives just to the side of the bone, is our anterior tibialis. It's a really important muscle in ankle mechanics and in controlling your balance and things like that. Its primary job is to decelerate your foot as you take a step, so your heel hits, and that's the muscle that keeps your foot from slapping down. So that muscle can become inflamed, and it can kind of swell and put some stress in the compartment that it lives in and on the kind of the membrane around it. And that can be a source of pain. A lot of times when people have changed running surfaces recently or have changed footwear pretty drastically, that muscle can have a hard time adapting. So a lot of times that can be a source of pain. It could also be a bony stress that occurs at that shin bone, where that bone starts to experience some swelling and starts to bones are really sensitive. So any kind of swelling, any kind of inflammation around the bone can be really painful. So a lot of times it's associated with surfaces, how you're walking, how you're running, and mechanics of those activities as well. So the stresses that we're introducing to that area, and a lot of times there's just a small change that can lead to issues down the road. Great way to fix this: make sure that you're staying stretched out before you run, make sure that you're cooling down correctly, and make sure that you're wearing footwear that fits what you want, and make sure you're not ramping up into a new shoe or a new running surface too quickly. So when you're introducing these new stresses to your leg, which is going to be great for you, going to make you a better runner, going to make you better at walking, going to really improve how you're feeling. We want to make sure that we're doing that slowly. Make sure you're grading that according to what your body can tolerate. So a lot of times, proper footwear, proper surface, over-the-counter medication can help you manage the pain and help you manage that inflammation a little bit. And different modalities like ice and compression can help you feel a little bit better too. Best way to make sure you're taking care of these shin splints correctly, though, is make sure you're seeing a physical therapist. Make sure that if this is becoming a consistent problem, you get it addressed quickly so that you don't have to miss any time, you don't regress any, and you can get this taken care of before it becomes a very serious problem.